What is the most important diagnostic test to confirm the diagnosis when a patient with suspected STEMI has chest pain and difficulty breathing? A. Electrocardiogram (ECG). B. Echocardiography. C. Cardiac catheterization. D. Magnetic resonance imaging (MRI). Answer A. Electrocardiogram (ECG). A patient with chest pain and ST segment elevation on the EKG arrives at the emergency department. The nurse should prioritize the following actions. A. Administer aspirin and nitroglycerin. B. Call the cardiac catheterization lab. C. Perform a thorough physical assessment. D. Obtain a troponin level and arterial blood gas. Answer B. Call the cardiac catheterization lab. In the emergency department, a patient arrives complaining of chest pain that occurs unpredictably, even at rest. Which diagnostic test is most appropriate to confirm the diagnosis of unstable angina? A. Stress test. B. Electrocardiogram (ECG). C. Coronary angiography. D. Echocardiogram. Answer C. Coronary angiography. In the emergency department, a patient arrives with sudden onset severe leg pain, pallor, and absent pedal pulses. Which of the following assessment findings is characteristic of acute arterial occlusion? A. Elevated limb temperature. B. Increased capillary refill time. C. Diminished sensation. D. Weak or absent peripheral pulses. Answer D. Weak or absent peripheral pulses. A patient with a history of carotid artery stenosis presents with sudden onset weakness and difficulty speaking. Vital signs reveal a blood pressure of 180/90 mmHg and a heart rate of 110 bpm. What is the nurse's priority action? A. Administer aspirin and call the provider. B. Assess the patient's airway, breathing, and circulation. C. Place the patient in a supine position and elevate the legs. D. Perform a neurological assessment and document findings. Answer B. Assess the patient's airway, breathing, and circulation. Which preoperative test is essential for evaluating the extent of artery blockage before an endarterectomy? A. Complete blood count, CBC. B. Electrocardiogram, ECG. C. Angiography. D. Urinalysis. Answer C. Angiography. What is the primary purpose of femoral popliteal bypass surgery in patients with severe peripheral arterial disease, PAD, or critical limb ischemia? A. To remove plaque buildup from the femoral artery. B. To restore blood flow to the lower leg. C. To relieve pain and swelling from PAD. D. To prevent gangrene and infection. Answer B. To restore blood flow to the lower leg. A patient with a history of heart failure presents with acute dyspnea, crackles on lung auscultation, and frothy pink sputum. What is the nurse's initial action? A. Administer oxygen therapy at 2 liters per minute via nasal cannula. B. Initiate continuous positive airway pressure, CPAP. C. Elevate the head of the bed to Fowler's position. D. Prepare for rapid sequence intubation, RSI. Answer B. Initiate continuous positive airway pressure, CPAP. During the assessment of a patient with a thoracic aortic aneurysm, the nurse notes unequal blood pressure readings between the arms. Which action should the nurse take first? A. Reassess the blood pressure in both arms using different cuffs. B. Document the findings and continue with the assessment. C. Elevate the head of the bed and recheck the blood pressure. D. Notify the healthcare provider and prepare for immediate intervention. Answer D. Notify the healthcare provider and prepare for immediate intervention. A 60-year-old patient with a history of hypertension presents to the emergency department complaining of sudden onset severe chest pain radiating to the back. Blood pressure in the right arm measures 180/100 mmHg, while in the left arm, it's 140/80 mmHg. What diagnostic test should the nurse anticipate to confirm suspected aortic dissection? A. Chest X-ray for initial evaluation. B. Immediate administration of analgesics. C. Rapid initiation of anticoagulant therapy. D. Prompt preparation for CT angiography, CTA. Answer D. Prompt preparation for CT angiography, CTA. A 65-year-old patient presents to the emergency department with sudden, severe chest pain radiating to the back. The pain is described as tearing. On examination, there is a notable difference in blood pressure between the arms. What should be the nurse's immediate action based on these findings? A. Administering nitroglycerin for pain relief. B. Initiating fluid resuscitation with crystalloids. C. Notifying the healthcare provider immediately. D. Preparing the patient for immediate surgery. Answer C. Notifying the healthcare provider immediately. In the immediate postoperative period following CABG surgery, the nurse assesses the patient's cardiac rhythm and notes atrial fibrillation with rapid ventricular response. The priority intervention is to A. Administer amiodarone, cortisone. B. Prepare for synchronized cardioversion. C. Increase the rate of the intravenous infusion. D. Administer a bolus of intravenous calcium. Answer A. Administer amiodarone, cortisone. A patient undergoes heart valve surgery and is being monitored postoperatively. For hours after surgery, the nurse assesses the patient and notes a heart rate of 110 bpm, blood pressure of 90/60 mm of mercury, and urine output of 20 milliliters per hour. The nurse's immediate action should be to A. Administer a bolus of 4 fluids. B. Notify the healthcare provider. C. Document the findings and continue to monitor. D. Assess for signs of bleeding at the surgical site. Answer A. Administer a bolus of 4 fluids. A patient presents with sudden onset chest pain that radiates to the back, along with dyspnea and tachycardia. On examination, the patient has distended neck veins and muffled heart sounds. The nurse should suspect A. Aortic dissection. B. Myocardial infarction. C. Pulmonary embolism. D. Pericardial effusion. Answer D. Pericardial effusion. A patient involved in a motor vehicle accident presents with anterior chest trauma and sudden onset dyspnea. Upon examination, there are muffled heart sounds and distended neck veins. The nurse's priority action should be to A. Perform an immediate pericardiocentesis. B. Obtain a chest X-ray to assess for pneumothorax. C. Administer analgesia to manage the chest pain. D. Prepare for emergent cardiac ultrasound. Answer D. Prepare for emergent cardiac ultrasound. After a cardiac catheterization, the patient's groin puncture site begins bleeding profusely. The nurse's initial action should be to A. Apply firm pressure over the site. B. Administer intravenous fluids rapidly. C. Prepare for a blood transfusion. D. Elevate the patient's legs. Answer A. Apply firm pressure over the site. A 58-year-old male patient presents to the emergency room with symptoms of chest pain radiating down his left arm, dyspnea, and profuse sweating. His blood pressure is 80/50 mm of mercury, heart rate 110 bpm, and oxygen saturation 90% on room air. The nurse suspects cardiogenic shock due to A. Decreased oxygen demand of the heart. B. Increased preload leading to improved cardiac output. C. Inadequate tissue perfusion due to reduced cardiac output. D. Enhanced contractility of the myocardium. Answer C. Inadequate tissue perfusion due to reduced cardiac output. A 58-year-old male patient with a history of uncontrolled diabetes presents with fatigue, dyspnea, and lower extremity edema. Upon assessment, the nurse notes bilateral crackles upon auscultation and an enlarged left ventricle on the echocardiogram. The most likely diagnosis for this patient is A. Dilated cardiomyopathy. B. Pulmonary embolism. C. Hypertrophic cardiomyopathy. D. Restrictive cardiomyopathy. Answer A. Dilated cardiomyopathy. A 35-year-old female presents with chest pain exacerbated by exercise and relieved by rest. The echocardiogram shows asymmetric septal hypertrophy. Which condition is most likely causing her symptoms? A. Hypertrophic obstructive cardiomyopathy, HOCM. B. Dilated cardiomyopathy. C. Restrictive cardiomyopathy. D. Arrhythmogenic right ventricular cardiomyopathy. Answer A. Hypertrophic obstructive cardiomyopathy, HOCM. A patient with a history of unexplained dyspnea and fatigue presents with bilateral basilar crackles on lung auscultation. Echocardiography reveals ventricular dilatation and impaired systolic function. The nurse should suspect A. Hypertrophic cardiomyopathy. B. Restrictive cardiomyopathy. C. Arrhythmogenic right ventricular cardiomyopathy. D. Dilated cardiomyopathy. Answer D. Dilated cardiomyopathy. A 65-year-old male presents with dyspnea on exertion, peripheral edema, and fatigue. An echocardiogram reveals biatrial enlargement and preserved ejection fraction. Which diagnostic test would confirm the suspicion of restrictive cardiomyopathy? A. Cardiac catheterization. B. Endomyocardial biopsy. C. Coronary angiography. D. Exercise stress test. Answer B. Endomyocardial biopsy. A 60-year-old male presents to the emergency department with palpitations and dizziness. His ECG shows irregular QRS complexes with no discernible P waves, and the rhythm is irregularly irregular. Which type of arrhythmia is most likely present? A. Sinus bradycardia. B. Atrial fibrillation. C. Ventricular tachycardia. D. First-degree heart block. Answer B. Atrial fibrillation. A 65-year-old male with a history of heart failure presents with worsening dyspnea and bilateral crackles on lung auscultation. His BNP level is significantly elevated. Which diagnostic test should the nurse anticipate being ordered next? A. Chest X-ray. B. Echocardiogram. C. Cardiac catheterization. D. Pulmonary function tests. Answer B. Echocardiogram. A 55-year-old patient with a history of hypertension presents to the emergency department with severe headache, blurred vision, and epistaxis. Vital signs show BP 220/120 mmHg. What initial intervention should the nurse prioritize? A. Administering sublingual nitroglycerin. B. Initiating 4-labetalol infusion. C. Administering oral captopril. D. Applying ice packs to the forehead. Answer B. Initiating 4-labetalol infusion. A 45-year-old patient presents with syncope. ECG reveals a prolonged QD interval. What medication should the nurse be cautious in administering due to the risk of further prolonging the QD interval? A. Metoprolol. B. Amiodarone. C. Nitroglycerin. D. Furosemide. Answer B. Amiodarone. After being admitted with respiratory distress, a patient suddenly experiences chest pain, dyspnea, and tachycardia, and the nurse identifies an increased intensity of the pulmonary S2 sound upon auscultation. The nurse should suspect A. Aspiration pneumonia. B. Spontaneous pneumothorax. C. Pleural effusion. D. Pulmonary embolus. Answer D. Pulmonary embolus. A patient admitted with severe sepsis suddenly develops dyspnea, tachypnea, and diffuse crackles on lung auscultation. ABG analysis on 4 liters per minute oxygen via nasal cannula shows pH 7.48, PCO 230 mm of mercury, and P2 55 mm of mercury. Chest X-ray indicates bilateral opacities. What condition should the nurse suspect? A. Acute respiratory distress syndrome, ARDS. B. Pneumothorax. C. Pulmonary embolism. D. Pneumonia. Answer A. Acute respiratory distress syndrome, ARDS. The arterial blood gas analysis of a patient admitted with shortness of breath and hypoxemia, diagnosed with acute respiratory failure, shows pH 7.30, PCO2-55 mmHg, P2-50 mmHg. The nurse anticipates which intervention is a priority. A. Administering bronchodilators. B. Initiating non-invasive positive pressure ventilation. C. Increasing the oxygen flow rate. D. Administering 4 corticosteroids. Answer B. Initiating non-invasive positive pressure ventilation. Which intervention should the nurse anticipate as the next step in management when a patient admitted with hospital-acquired pneumonia, HAP, experiences worsening respiratory distress despite antibiotic therapy? A. Administering intravenous corticosteroids to reduce inflammation. B. Initiating non-invasive positive pressure ventilation, NPPV, to support ventilation. C. Arranging for emergent intubation and mechanical ventilation. D. Administering inhaled bronchodilators to improve airway patency. Answer C. Arranging for emergent intubation and mechanical ventilation. A 78-year-old patient with a history of dysphagia and recent aspiration episodes presents to the emergency department with confusion, fever, and productive cough with purulent sputum. What is the most appropriate initial nursing intervention? A. Initiate droplet precautions to prevent the spread of infection. B. Perform chest physiotherapy to promote airway clearance. C. Administer intravenous fluids to maintain hydration status. D. Assess the patient's oxygenation and respiratory status. Answer D. Assess the patient's oxygenation and respiratory status. Which pathophysiological process is primarily responsible for the development of ARDS in a patient admitted with pneumonia who develops acute respiratory distress syndrome, ARDS? A. Pulmonary embolism. B. Sepsis-induced systemic inflammation. C. Aspiration of gastric contents. D. Pulmonary fibrosis. Answer B. Sepsis-induced systemic inflammation. During mealtime, a patient with a history of dysphagia presents with sudden onset dyspnea and coughing. The nurse should suspect A. Silent aspiration. B. Acute respiratory distress syndrome. C. Pulmonary embolism. D. Gastroesophageal reflux disease. Answer A. Silent aspiration. A patient with Parkinson's disease experiences frequent episodes of coughing and choking while eating. The nurse identifies the need for A. Swallowing exercises. B. Bronchoscopy. C. Mechanical ventilation. D. Parenteral nutrition. Answer A. Swallowing exercises. What should be the nurse's priority intervention when a patient with a history of chronic obstructive pulmonary disease, COPD, presents to the emergency department with heightened dyspnea, productive cough, fever, and bilateral coarse crackles upon auscultation? A. Administering a bronchodilator and corticosteroid nebulization. B. Initiating non-invasive positive pressure ventilation, NIPPV. C. Ordering a chest X-ray and sputum culture. D. Administering intravenous antibiotics and oxygen therapy. Answer D. Administering intravenous antibiotics and oxygen therapy. The nurse observes tremors, tachycardia, and agitation in a patient admitted with asthma exacerbation receiving frequent albuterol nebulizations. Which intervention should the nurse implement first? A. Administering a beta blocker. B. Reducing the frequency of nebulizations. C. Administering a corticosteroid. D. Assessing for hypokalemia. Answer B. Reducing the frequency of nebulizations. A patient with severe asthma presents to the emergency department with increased dyspnea, chest tightness, and audible wheezing. Vital signs include a respiratory rate of 28 breaths/min, heart rate 110 bpm, oxygen saturation 89% on room air, and a peak expiratory flow rate, PFR, of 50% of predicted. The nurse should anticipate which of the following interventions is a priority. A. Administering magnesium sulfate intravenously. B. Initiating continuous positive airway pressure, CPAP. C. Administering a short-acting beta agonist, SABA, nebulizer treatment. D. Placing the patient in a supine position with legs elevated. Answer: C. Administering a short-acting beta agonist, SABA, nebulizer treatment. In the intensive care unit, a patient fails multiple attempts to wean from mechanical ventilation despite the optimization of medical therapy. Arterial blood gas analysis shows pH 7.48, PaCO 250 mm of mercury, PaO 268 mm of mercury, HCO 332 milliequivalent/L. The nurse should suspect A. Respiratory muscle weakness. B. Pulmonary embolism. C. Pneumothorax. D. Exacerbation of chronic obstructive pulmonary disease, COPD. Answer: A. Respiratory muscle weakness. During attempts to wean from mechanical ventilation, a patient with a history of chronic obstructive pulmonary disease, COPD, is unable to tolerate spontaneous breathing trials. The nurse identifies the primary reason for this difficulty as A. Increased airway resistance. B. Decreased lung compliance. C. Inadequate respiratory drive. D. Impaired gas exchange. Answer: A. Increased airway resistance. A sudden onset of dyspnea, tachypnea, and reduced breath sounds on the affected side is observed in a patient with a history of chronic obstructive pulmonary disease, COPD. The nurse suspects A. Pneumothorax. B. Pleural effusion. C. Hemothorax. D. Empyema. Answer: A. Pneumothorax. A patient with a recent history of thoracentesis develops fever, chest pain, and purulent pleural fluid drainage. The nurse suspects A. Pneumothorax. B. Pleural effusion. C. Hemothorax. D. Empyema. Answer: D. Empyema.